So today I'm going to talk about my Pcos journey, my Hydrosalpinx journey. So I'm about to get into it. I used to feel shame somewhat because as a young girl going through all of this, I don't have kids as yet, actually going through all of this, there was just a little guilt or some shame in it. But I've learned that there is no shame to it. Women, we go through it. There are people that are going through worse, or that were going through worse than I was going through at that time. So I just want to share this part of my life and more to come. So I hope you like this content. Don't forget to like, share and subscribe, and I hope you just feel inspired. To those who are watching that might be going through similar, hold on, it's not you alone, just hold on. So just stay tuned, guys. So we are all the way in 2023 and I'm somewhat better now, but backward a bit to 2018 was when I fell ill and I went to the doctor and I did ultrasound to see what's happening, because I had abdominal cramps and so forth. So everything just turned out to be, because I didn't eat, I had gas. But new findings now, they went and did a little ovary check and so forth. Turns out that I had cysts in my ovaries. So irregular menstrual, the fatigue, like the constant on and off. I wasn't sure, oh yeah, is it going to come this month, is it going to come next month? So guys, I'm going to try and jumble all I have to say in this one video, because I really don't want it to be that long. But yeah, so Pcos, polycystic ovarian syndrome. In my case, that's what I thought I had. Like, it was just, I guess to me it was like a one time I went to the doctor and they saw the cyst. But it's always closer to my menstrual cycle that I keep doing the ultrasounds. But with the irregular period, the irregular bleeding and all of that, I was so concerned. So this was like 2018. I went to the doctor gave me birth controls. But before that, that was the beginning of my long distance relationship, and he was about to visit. So as a young girl, you might know what I'm saying, or even any age range. When your menstrual come, if you want to go to a party, or if you have a specific date or something, you're like, you want to stop it because you don't want it to spoil any plans. So I had a friend that said to me, oh yeah, such and such, you can use this. So I used Minigynon to stop my menstrual. Lo and behold, I did not know that I was starting to like put my body in self-destruct mode. I'm now finding out that no, because then I did not know, because I'm like, what is all of this on my body now? So I stopped it. He came visit, all one and whatever. Fast forward now, even before I took the birth control to stop my menstrual, at the time I had irregular period, I had massive weight gain. I tried doing a whole lot, it never did work. The irregular bleeding, the constant fatigue and all of this bloatedness. So but then with the birth control, it got worse. I went to a doctor. The first doctor I went to, she was like, no bedside manner. She's basically like, oh yeah, I'm just going to just dash you some birth control pills and you see if that works out. I was taking those and it did not feel good. It did not feel good. I felt sick, I felt worse, still threw off my menstrual, worse. Then she prescribed Narcolot, that's another one. Worse. I kept going to the doctors every other time, and until I've developed a relationship with the radiologist, and he was like, he's getting concerned because the cyst and is not like every other time I go is the size or something. So he says probably it's more than that, or you know. So I end up change doctor around the time that I changed doctor. So this is from 2018 to 2019. I got married in 2019. Sometimes when my husband would fly down, nothing could go on because the body just not function. And that was frustrating for me because months apart, and then like I'm seeing my partner, I'm supposed to be enjoying myself, dancing all about. But yeah, so before I changed doctor, I tried this herbalist on Instagram. I was taking magnesium, primrose, I was taking a whole lot of vitamin C, vitamin D, a lot of supplements, like trying to regulate my menstrual. I'm not going to lie, raspberry tea, I'm not going to lie, it was helping, but the way I was feeling, I could not pull through with all of those things. Like my body was saying no. There were times when I felt so sad, I felt depressed, because with my body not functioning, you know, the need for your partner to be near you, you know, the comfort and all of that, I had to go through that as well, which was hard. So all of that frustration, having to go to the doctor, and then I'm like, I was scared to talk to people about it, like talk to my friends about it, because I'm like, I see everybody else having babies and all of this, and why can't it be that easy for me? Why does my body have to be going through all of this? That's how I was. And there was this shame, like, oh, to even mention it, because lo and behold, I thought that, oh, this was a secret thing. Like, I was so hidden in the world, but hidden in a sense where nobody else now go through this, nobody else now whatever. And in around that time, in doing research, being on the internet, and seeing that there's a lot of women that have Pcos, a lot of women. Some have been successful with pregnancies afterwards. There's fibroids, there's endometriosis. I did a lot of scans to say, oh, maybe it's fibroids, maybe it's endometriosis. Sometimes my walls feel very, very crampy and achy, and I'm like, I'm over this. I'm saying, God, maybe tomorrow I'm going to get up and it's going to feel different. Maybe next month it's going to be different. So I tried the herbalist, that wasn't going well, but I still was trying, I was still holding on to that. But then I changed to a wonderful gynecologist, and she was like, I'm not going to give you any birth control pills. She listened to me. The first doctor did not listen. She was just being a doctor, not saying, oh, she should have me as her best friend or anything. But the other doctor that I had, that I changed to, she formed a patient-doctor relationship. She was concerned, bedside manner, everything. I felt so much better with her. And I said to her that I'm trying this. She said, what are you doing to, she asked me first, what are you doing to help your body while it's going through this and whatever? And I told her that I'm trying the weight loss thing, I'm trying to lower my sugar intake, you know, work out, do juice mix, cucumber, celery and all of that. And I told her about the herbalist, and she said, how is that going? I said, it's raspberry tea and some other things like magnesium. And she said, okay, you can do that if you want, you can continue to do it and whatever. And she also suggested things, and she made me do ultrasound. But then it got really frustrating because there was the pain on my left side where I thought the cyst was, and there's this constant pain on my right side. So I got more concerned. So in her suggesting that I do more ultrasounds, there was a new findings now where they're seeing that a lesion is stretched all the way across the top of my uterus. So it's not just the right cyst, persistent cyst. So it was supposed to be a right persistent cyst all along, they're seeing on the ultrasound. So now there is the right tube that is so appeared to be swollen. No, my previous relationship, I did not got any like any urge to go to the doctor to say, oh yeah, because you know, young, and I say young and we're free and whatever, everything was fine. Previous relationship, everything was fine. Previous years, age, everything fine. So I'm like, no, you know, say I meet this guy, I'm married now, and I'm supposed to be enjoying life, and when I have no problem, look forward to our future kids, whatever. So when she told me, when they found out that my right tube is swollen and it's somewhat causing some of the aches, the pelvic pain, they asked, you know, the questions, have you ever been treated or whatever? I have never been treated. They say, oh, the bare minimum infection that I ever had was yeast infection. That almost killed me. That almost took me out. Even having a yeast infection, the first time I had that, I was like, I thought I was going to die. I cried to my mother and my grandmother constantly until I was like, mommy, you may go tell her this, and then go to the doctor and you find out, and they took care of me like a baby. So any other infection, no, I haven't. So I'm like, what is this? So they're saying that they're seeing like there's fluid buildup in my right fallopian tube, fast forward to 2021. I'm like, I'm still going with this new doctor and we have a nice relationship. So we agreed that, okay, I'm going to be doing a surgery. So she's affiliated with a big hospital, but she has her private practice. So with insurance, I'm like, I don't think I can afford her, but she didn't just want the money for herself, she cared about me and so forth. So she gave me a referral to go to a public hospital, University of the West Indies. That's where I got my surgery done. So after hearing all that, while going through so many stress with my body, hearing that I have polycystic ovarian syndrome, in going to university hospital, I did blood checks. Oh, the anemia, there were times when I couldn't go on. My iron level was low. My iron level was so low, I felt like I couldn't. The vomiting, there are days when all I could do is just lie down and just do nothing. I don't want to be progressive. My mind, my body feeling overwhelmed, I felt so attacking my mind. I'm like, then the worrying, I'll never have kids, blah blah blah. I'm like, I can't talk to people about this because they won't understand it. Especially sometimes I felt like I couldn't talk to my friends that have kids because, oh, it happened for you, so I don't think you would understand. You're not going through this. But as I said, I've grown and I've seen difference in me talking to my friends and so forth. They have embraced me. They too have challenges in their bodies, and we are all women and we all go through. And I felt my thing was my pride. As a young girl, my pride, I was like, let me just suffer in silence. Let me just suffer in silence. But then over time I've learned to embrace it, because it's not all bad. It's not. It was never all bad. So yeah, my doctor gave me a referral, and I went to University Hospital, the gynecology department. I started the clinic. The first day I went there to do the first clinic day, the doctor was like, okay, when you want to do the surgery? And I'm like, when I want to do the surgery, sir, you don't even find out if I have the money can pay for the surgery. Where I was working, I've been working there for three plus years, so I have health insurance and everything, so I know it wasn't going to be, I would probably have a 20% out of pocket. But I'm like, sir. And then a next thing too, in me wanting to remove whatever was in my body, I was like, I cannot afford this. But it's either cannot afford it or make it kill me, because the tube, my swollen tube, eventually, because it was weighing on my body, so I was like silently dying because I was worried about cost. I didn't go anywhere. I didn't find out about anything because I didn't want to hear how much I'm going to pay for anything. Cost. People around me, my husband was like, your health matters, go and find out about this and blah blah blah. And then the whole scare, I didn't want any complications or nothing like that. So in my first visit, he was like, I went there to the clinic February 2022, and he was like, yeah, so when you went to the surgeon, I said, when I went to the surgeon, how much is it to do the surgery? And he said the estimated cost would be 200 and something thousand dollars. I'm like, but it wouldn't be a laparoscopic surgery. I would get a, you know, the bikini cut, like a C-section cut. So we agreed to do the surgery the following April. So I only had like 2 months. And you know, I went back to my doctor and I tell her that we made plans to do this. So I had one more clinic visit before I did the surgery. Fast forward, no, let's not fast forward it. So I'm trying to do this bam bam bam, so it's not too long for you guys. So I'm like, I felt so good. I was telling my friends, my family, everybody. I was excited because for years I've been battling with this cysts or these cysts. I know I was kind of sad about the tube because of my age. I'm like, I'm only going to have one fallopian tube, but over time I'm like, my health matters. It doesn't matter if you know, a little hiccup going forward or in my future, that's fine. For now, presently, my health is what matters to me most. So in the final ultrasound that I did, I went to my doctor and I told him that I'm going to do the radiologist, and he was like, by this time he knows my name because I've been there a lot. He knows my name, has my file, everything, and he's like, he thinks there's more. I probably need to do a mammogram or something like that, just to do other checks to make sure that everything else is fine. So I got my final ultrasound, but the previous one, I remember the previous one that I did before the final one leading to the surgery, he said he was not seeing any cysts. But then I'm like, I don't want to ignore it now, and then there comes a cyst. So after the final ultrasound, you know, we sit and we agree. I did my final clinic date, did submit my insurance. In total for my surgery, it was $150 something thousand from $230,000, I think, to $150 something thousand. I'm going to tell you how it got up to that. So, you know, I informed my family. I was driving, but I live far, so I had to stay in Kingston. I lived at the time in rural St. Andrew, for my Jamaicans watching. Rural St. Andrew, up in the hills, the Pcos hills. So I couldn't drive that far after my surgery, so I had to bring down my car in Kingston. I had to bring down my car, and I had to have people drop me off at the hospital. Family members drop me off at the hospital because my family lives in Kingston, so I had to stay with them. Mind you, all of this that I'm going through, my husband is overseas. He has just, all we have is just a phone for him to see what is happening or for me to update him. That was a challenge in itself. Long distance was a challenge in itself, but I pulled through and I'm here. So going to the surgery now, the surgery was the April 22nd, 2022. I had to do a COVID test 3 days before, and then I had to go to the hospital. I had to check in the 21st of April. So you know, I took COVID test, come back positive. I did my checks, check in, you know, every little thing. The surgery was 8 o'clock in the morning. The surgery was 8 o'clock in the morning, and the night before I had to stop eating by 6 o'clock. The nurse came in and she gave me enema because they wanted me to be empty for my surgery. Leading up to this, I was praying, having faith in God. the prep talk scared me because he's like, if he goes in and there's a lot of cysts, they probably have to take out my ovary. Taking out my ovary, there's early menopause. Like, I am just 25. I'm just 25. Early menopause. I start get afraid, but I'm like, God, I'm trusting you. I am trusting you. All I was on my mind is like, I'm finally getting rid of whatever is in my body causing problem. I'm getting rid of it, and I'm going to be better. I'm going to go to the gym. I'm going to live a healthier life, because I can't be putting too much in my body and expect to get good when I'm putting too much bad in it. I was going to stay away from birth control. Yes. And I would never stop my period again for anything. I had a lot of, I was doing a lot of self-blame. I was, even though I know that all of this was happening before I did that period stopping thing, the stopping of the menstrual, but I did a lot of self-blame. So surgery time now, you know, I got my enema and I empty out. I got up the morning, it got me up 7:30 or so, because I had to go to the operating room at that time. I went in, I was nervous. I was so nervous. But yeah, I'm going to be talking about the Hydrosalpinx in another video, because this is too long. But this is just the polycystic ovarian syndrome part of it. So mind you, they're telling me that if I have too many cysts, they're going to have to take out the ovaries, early menopause. I'm like, God, it's all in your hands. I went into that surgery room thinking that I had a lot of cysts in my ovaries. I was thinking that, oh yeah, it's bad. I was awake throughout the surgery, and lo and behold, when that doctor went in, I had no cyst. All there was a swollen fallopian tube. I went in after 8 and I got out before 9:30. It was just an in and out. Ever since I did that surgery, I took out my tube, so now I have one fallopian tube. That feels good. I usually felt a little ache when I said that, but this feels good now, in me embracing, in me educating myself more. But I went into that surgery thinking that there was this cyst in my body all along. I was taking birth control, frustrating my body. All there was a big swollen tube in my womb. Or no, not in my womb. All there was in my pelvic. That's all there was. When the doctor opened up and he was like, okay, I'm done. I'm like, are you done? Do you see any cysts? And he said, no, there's no cysts. I'm like, huh? Are you sure? Because I was awake, you know. They did the spinal. So I'm like, huh? He's like, yes. I was so shocked. I was like, thank you, Jesus, thank you, Jesus, thank you. I was not even concerned about the fact that, okay, it's just one tube you have now in a girl. I'm like, so for years I was battling, saying, oh, I have Pcos, I have Pcos, I have Pcos, I have Pcos, I have Pcos. Not a Pcos. But after I did that surgery, I had my menstrual. It would even come 2 days early. I started losing weight because I'm like, okay, I'm going to be taking care of my body. I had a whole life change, because remember, I planned to do it before the surgery, you know. So in me saying, okay, I'm going to take out this cyst now, I'm like, let's get to work. But as I said, I'm happy I did the surgery. I'm going to do another video to talk about the right salpingectomy. That's what I ended up doing, because I don't want this one to be long. But I know there are a lot of people, a lot of young girls going through this Pcos thing with our bodies. You are not alone. You are not alone. And since recently I went to the doctor, they said that they saw a right simple cyst. I'm not even worried about it. I'm not even putting that on my head again. I'm just trying to do what I can for my body now so that it's healthy. Before, I was all the way concerned about being a mom and all of that, not knowing that I have to put in the work, I have to do the good so I can reap the good, even out of my body, in every aspect of my life. So when the time comes, I have my little nugget or my little peanut. But so yeah, that's my little Pcos experience, my little Pcos thought. I tried to put everything, you know, it might sound a little jumbled because I didn't want it to be too long, but stay strong if you're going through this, your body is going through this. Stay strong, you're not alone. Don't be ashamed. Talk to somebody, talk to people, talk to other women, talk to your friends, get educated. Don't sit, because depression is not nice. Depression is not nice. Depression is not nice. And I hope you like this content. I have a lot more on the other side of this video, so just stay tuned. Don't forget to like, share and subscribe, and I hope you like this content. Until next time, love you.